to be going over some special tests for the patellofemoral joint. The first one we'll be reviewing is the Patellar Apprehension test, and this test is performed on young athletes who may have some patellar ligamentous laxity or a prior history of patellar subluxations. In this test, you can perform it two separate ways. You can do it either in extension, as we have here, or 30 degrees of flexion. For this first one, we'll do extension. All you're going to do is apply a lateral force to the patella, a force to the medial patella, pushing it laterally. And then we'll do it again in 30 degrees of flexion, pushing the patella laterally. With this test, you're less likely to get a positive result in the area of flexion because you will be pressing the patella up against the lateral femoral condyle. A positive sign for this test would be apprehension from the patient. Now, this could come verbally with the patient telling you to stop, or that they feel that their knee might dislocate, or it could be a physical stopping of the action. There could also be increased anxiety in their face if you watch facial expressions, or you could feel the quadriceps begin to guard the patella. Unfortunately, this test in a study by Nijs et al. Is not very sensitive, with a sensitivity of 39%. It also has a positive likelihood ratio of 2.26 and a negative likelihood ratio of 0.79. So another test that you could do is the moving patellar apprehension test. In this test, you will apply the same lateral force to the patella, and you'll hold it there in extension, and then from extension, go into 90 degrees of knee flexion. Then you will bring it back down into extension. This is a more functional test for patellar dislocations, and you will be looking for the same signs as you would for the regular patellar apprehension test.
I'm going to be showing the patellar grind test, or Clark sign. So, according to a study by Doberstein, it has a sensitivity of 0.39, a specificity of 0.67, a positive likelihood ratio of 1.18, and a negative likelihood ratio of 0.91. So to do the test, I'm going to use the web of my hand to at the superior aspect of the patella. I'm going to ask the patient to contract the quad, and while she does that, I'm going to provide an inferior glide of the patella. A positive test would be that the patient has reproduction of symptoms with this test, or they also cannot perform the contraction during the test, and this would indicate that they have patellofemoral joint disorder.